Good morning. As you're all aware, there's been some major events in the last 24 hours, especially related to the President's messaging last night regarding the scope of the containment that's being recommended. Locally, however, we have no reported positive cases on Cape Cod as far as I'm aware to date. Currently, we're still encouraging the kind of basic isolation precautions, hand washing, social distancing messaging that has come out of the Vice President's Coronavirus Task Force over the last 72 hours. And those are available on coronavirus.gov. There's a flyer that's available for workplaces, for homes, for commercial establishments, and that's still our approach currently as testing is being ramped up slowly across the country, still not widely available in our facility or in our area. So we're still recommending that people practice kind of just the routine respiratory etiquette, hand washing, surface cleaning, et cetera. And we're also encouraging that people who are not severely ill not present to their physicians for testing for COVID-19, since it's not really widely available at this point, and that really for most respiratory illnesses, unless people are severely ill, we recommend they just stay home and not present to their doctor's offices unless they're having difficulty with breathing, fever, or severe coughing where it's interfering with their functioning. So I'm happy to take some questions now.
We also received quite a few questions in advance, so I can reference some of those. And again, feel free to submit your questions, and we will do our best to get to those as well. So Dr. Pombo, just to remind our callers, what is the process that people should be following if they are ill? And you said, we're encouraging people not to just go straight to their doctor's office. What are we encouraging patients to do if they are showing any of the symptoms?
Well, the symptoms that are concerning would be fever, cough, difficulty breathing. If those are present, then people may need medical evaluation. But if people are just having a slight cough, not high fever, and no dyspnea or difficulty breathing, then they should probably stay home from work and kind of do social isolation and frequent hand washing. Stay no more than 3 to 6 feet within the personal space of another person, and so forth. We're still recommending that people be evaluated only if they're having shortness of breath, high fever, or a severe cough that is interfering with their breathing.
We have a question here about transmission to pets. Can you provide an update on that?
I think there have been reports of transmission of coronavirus to pets, and I did read one report where there was what was described as a low-level infection. I think that means the dog was not very sick in a dog of somebody who has the coronavirus. I think if you are sick with a respiratory illness, you should treat the dog like any other member of the family. Don't cough in their face. Don't have the dog lick your face. Wash your hands after you contact the dog, et cetera, et cetera. But there is a dog visiting program at the hospital that's been voluntarily curtailed. We were going to suggest it be curtailed, but the facility that provides those dogs voluntarily kind of withdrew that service. So there is some concern about transfer to animals. Dogs I've heard about. I'm not sure if it can be transferred to cats, but I wouldn't be surprised. So I think you should just treat the dog like any other member of the family and use frequent hand washing and respiratory etiquette with the dog as well.
So there's a question here about an update on vaccine. We're hearing a lot about testing, and we'll get to that. I know there's a lot of questions about the testing process, and again, it continues to evolve. Do we have any updates on what the status is on vaccine testing and or any other treatments for coronavirus?
I think Dr. Anthony Fauci was widely quoted in the press recently about the long lead time for development of a vaccine. It's easy to produce the antigen, but to show that it's safe and effective and then to test it in large populations to show that it's efficacious is going to be a 12 to 18-month process, according to Dr. Fauci, and I'd agree with that. In terms of treatments, there are antiviral treatments that are under study. None of them has been shown to be efficacious for this coronavirus, and at this point, it's still in the status of trials. So there are some drug therapy trials being performed nationwide, but they're randomized just to see if there's any evidence of efficacy. There are some compassionate use protocols using drugs for Ebola virus, but those are not known to be effective.
I was going to ask about Tamiflu, understanding that some of these symptoms are similar to a flu. Have we heard if Tamiflu's been being prescribed to coronavirus patients and or is effective?
To my knowledge, there's no indication that Tamiflu has any efficacy against this virus.
All right. Sure. So back to kind of process. We're functioning under the assumption that folks have a PCP that they can call if they have questions. So this is a great question. So what happens if I don't have a PCP? What should I do?
Well, people who are ill with a respiratory illness, if they don't have a primary care physician, as I said, don't necessarily need to be evaluated. They would only need to be evaluated at high unremitting, or in that case, they would have to present to the emergency department or to an urgent care clinic if they really are sick and having difficulty with breathing. But otherwise, they just need to practice social distancing, hand hygiene, and the regular kind of respiratory virus etiquette.
And obviously, patients can reach out to Cape Cod Healthcare if they're interested in becoming a patient. So let's get to the topic of testing, because again, I know it's a moving target and there's a lot of interest here. Can you provide an update on what the current guidelines for testing are based on the CDC, which we continue to follow?
Yeah, as of the current time, our testing is still being adjudicated by the state lab, and we're following the more revised criteria for testing, which includes people who've had contact with a coronavirus case or somebody who has had contact with a patient from a high-risk area and has symptoms of fever, cough, and shortness of breath. And we're doing testing for people who have hospitalization and have been ruled out for other respiratory viruses. And currently, the testing is being rolled out through the commercial labs, LabCorp and Quest, but it's still a very unusual situation where we can get testing done in a rapid turnaround time. It's going to be at least a 3 to 4 day turnaround time. And Cape Cod Hospital is working on getting that operational. But at this point, we're still recommending that people use the CDC criteria. And we're currently running the cases that present to Cape Cod Hospital by the state health lab, and they're kind of recommending whether we can or can't test people. Now, the Vice President made some announcements earlier this week that testing is available through any physician's ordering, and that will be probably within the next week to 10 days that will be kind of functional. But currently, we recommend the people who only fit those criteria to be tested.
And can you remind us what the actual testing process is like? So
Sure.
In terms of swabs, and as you said, you're sending these up to the state, but just helpful to understand how someone is actually tested.
Sure. The testing for the respiratory viruses currently is done with a PCR test, which is a nucleic acid amplification process, and it's best done off of a nasopharyngeal swab. We use a very small diameter swab, which is placed up into the naropharynx on both sides, and we also collect an oropharyngeal swab, which is basically the back of the throat. And those are kind of combined into a tube and then sent off to the lab, and that will be, as I said, at least a 3 to 4 day turnaround time, either through the state lab or soon, we hope, through the commercial labs.
And so during that 3 to 4 day period, the patient is either obviously hospitalized because they're very ill, or they are sent home. Is that correct?
Yeah. Patients who present with a respiratory illness and get the testing are advised to go home and quarantine themselves and use social distancing as I described until the test results can be received. Now, the respiratory viral testing can be done more quickly for the routine viruses, but the COVID-19 virus is going to take probably at least 3 to 4 days.
There's a question here about the steps that Cape Cod Healthcare is taking in terms of precautions to other patients. So can you help us understand some of the steps we're taking in terms of limiting exposure to other patients, as well as how the patient is managed when they come in?
Mm-hmm. Our clinics have been instructed to inform patients to mask when they first present if there's any respiratory symptoms. We're providing scripts that the clinics can all use to ensure that there's a coherent and consistent message that patients who present with respiratory symptoms be masked immediately or encouraged not to come if their symptoms are not kind of necessarily severe. In the emergency departments, we have a screening process that's very similar. All patients with respiratory symptoms get masked, placed in a room right away to move them away from patients in the waiting room, and those patients are evaluated for high-risk criteria for COVID-19, and then they're adjudicated into getting either respiratory viral testing and or COVID virus testing or not. And patients who are not ill are then sent home immediately. Patients who need to be hospitalized are kept in droplet, airborne, and contact precautions. And then we're waiting for the testing on a few patients, but none of them have so far been, to my knowledge, positive for the COVID-19 virus.
So along those lines, I know this situation is evolving so much. Number one, we have seen an awful lot of each other in the past week. And prior to COVID-19, we had not met. So that's quite indicative of you know, how much planning is going on behind the scenes to kind of stay apprised of the evolution of this virus. And testing is obviously a big part of that. Can you share how our team is really thinking about testing, understanding that ideally it will be coming to Cape Cod, we'll be able to, you know, hopefully manage it in a bit more timely fashion? Sure.
Cape Cod Healthcare has been very proactive in terms of planning. We're meeting twice a day, at least 2 times a week, to go over both the operational things that will allow us to do testing in a larger scale, and we're also meeting just to make sure the processes that will protect patients in the hospital are widely disseminated and widely understood by the staff, and includes primarily processes to isolate patients and to provide personal protective equipment to the staff in a way that is highly functional and protective. In terms of the testing, we're planning on establishing a centralized place where patients could be screened and evaluated and tested if necessary. That will be a place potentially off-site so that we don't bring those patients into the hospital. That's still being developed. In terms of the testing, as I said, it's evolving almost on a day-to-day basis. As of today, I would still recommend that people follow the CDC criteria and only be evaluated if they meet high-risk area travel, contact with a patient who has an established disease, or if they're somebody who has a high-risk medical condition that would put them at risk for COVID-19 disease and have severe respiratory symptoms. So right now we're not encouraging the general public who have respiratory illnesses to get evaluated for COVID-19 as the testing is out at this point widely available.
So obviously we're, you know, and I know there are teams who are meeting, you know, multiple times per day, again, huddling with staff to just make sure that information is being cascaded across the healthcare system. So we're dealing with the day-to-day, but also keeping an eye on the big picture, which is that, you know, cases are, you know, the cases continue to grow, the number of cases, the number of deaths continue to grow, and, you know, it doesn't seem like this virus is slowing down in the U.S. So, you know, can you explain how we're kind of planning for if this plays out the way that we expect it may in terms of number of cases on Cape Cod, how Cape Cod Healthcare is planning to accommodate the number of patients that we may need to treat in kind of worst case scenario?
So our planning for a large number of patients involves establishing zones in the hospital where patients could be kind of cohorted, establishing areas of the hospital where we could have negative air pressure and make a whole unit like an airborne isolation area. We're establishing whether we can have off-site beds that might be available for people who need oxygen therapy but wouldn't be necessarily otherwise hospitalized. We're establishing whether we can convert rooms that are single rooms into rooms where patients with similar respiratory diseases could be cohorted. There's a whole supply chain effort to make sure all of our personal protective equipment is available, and those people are working around the clock.
So I don't know if we have we have a formalized statement on if people should be avoiding large events or large groups. I do know that there's been some events that have been canceled on Cape Cod. Do you have any perspective on if people should be? I was at a gym class last night. I'm like, oh no, should I not be going to the gym class? Do we have any perspective to share on cautionary steps?
Well, Cape Cod Healthcare employees have been advised that any non-essential travel has been canceled. We're recommending that large groups not be assembled. We're still having meetings in the hospital, but we don't have any situation where we're planning to establish any large gatherings in the hospital. Over the past 24 hours, there have been a whole slew of cancellations of major sporting events. I think the NBA canceled their season for the rest of the year. So I think it's just part of the recommendation that avoid large crowds, because certainly there's not been enough of a documentation of how widespread coronavirus is in the communities, and it's possible it's established in many areas that we're not yet aware of. And so if you put a few hundred people together, there may be a chance that one of those people could infect a number of others. And at this point, I think it's just common sense to, over the next week, avoid any kind of large gatherings.
Good judgment. Yeah. Anything else to share? I think we've addressed just about all of the questions that we've received. Again, understanding this is evolving by the day here.
Yeah, I'm just looking up on the screen. There are a number of questions about number of hospital beds that we have, whether that would be sufficient to handle the potential impact. As I said, we're looking at establishing cohorting of patients in the hospital and even off-site facilities that could handle patients who need to be cared for in a kind of a medical setting. So I think that it's very hard to predict the future, but we're doing the planning that we can to determine what facilities are available if we have a surge situation. That's a major effort of the Cape Cod healthcare planning. In terms of how many, there's a question here about how many test kits we have on hand. Are there enough? We don't have any of the testing available here. It's available through the state, and they do have sufficient test kits to kind of screen the people who meet their criteria. And over the next week, there's going to be a big change in the testing that's available through commercial labs, and I think that that's going to be a question for them. I don't really know what their status is in terms of test kits, but I think at this point, people have to realize there's a big lag time. If you get tested, you're going to probably be at least 4 days before you get any test results. So people will have to be kind of self-quarantining and staying away from other people who are not ill.
I think, you kind of referenced an important point, which is process. and that, we continue to look to the DPH, who continues to look to the CDC, and we continue to look to the CDC. And even internally, we continue to reinforce the importance of process. And so, as we continue to provide updates, those updates are knowing that we're relying on the process, right? And we will continue to follow the process. And so, we're really no different than any other health system in the state, frankly. No one is testing currently at their own facility, and when that changes, it will change for everyone. So again, we're committed to providing the latest information, understanding that, we're all following process here to help manage the situation.
Yeah. The most important thing now is if people are ill with a respiratory illness, that they should not come to work, and they should isolate themselves and kind of do whatever respiratory hygiene and respiratory etiquette that's been recommended. And those are available from coronavirus.gov, the cdc.gov coronavirus site, and the Massachusetts Department of Health coronavirus site. And those are recommendations that should be reviewed, and they are updated on a fairly frequent basis. Maybe every 2 to 3 days, people could check in and look at those websites, and that's the best information that's available.
There's a question here about having more frequent updates. So the beauty of press conferences is that we're not spreading germs, but also that, we can ramp these up if we need to. Again, our team is our top priority across the organization is, supporting the needs of our patients and clinical operations. And so, we are dedicated to providing timely updates. We're also dedicated to supporting the organization at large. So, we will continue to offer weekly updates for the foreseeable future. If we need to have a special update or if we need to ramp these up, we will. But again, just being mindful of Dr. Pombo's time as well as the marketing team here, we will do our best to balance both timeliness and information. So just to share that. And then question here about employees. I know that Cape Cod Healthcare just this morning put out a communication regarding employees and staying from home. Did you already address that one?
No.
Okay. Do you want to address that one?
Oh, I didn't see that.
Okay. Hot off the press.
So,
just this morning, Cape Cod Healthcare is encouraging their own staff that if they are sick, to stay home. And I know that is a message that many organizations have been communicating to their employees.
Yeah, that's a reiteration of a kind of standard policy that we don't have patients, we don't have employees come to work if they're ill. But in terms of working from home, there have been some large corporations, I think Microsoft and Amazon in New York are encouraging all their people to work from home. If somebody's ill, they should certainly work from home. I don't think that at this point we can make a recommendation that people are not ill not come to work. We haven't reached that recommendation yet in the country. The epidemiologists who look at the national status are going to advise the president, and we'll probably hear from the government about what their recommendations are for, more quarantine type of efforts. But at this point, it's really restricted to people who are ill should not come to work, and that's kind of been the message for a while.
Well, Dr. Pombo, I just want to thank you for all of your work to protect the local community, and I know that you've been, not only are you, actively planning with our organization, but you're also taking care of patients. So thank you for that, and thank you for everyone for dialing in and for understanding that we're doing our absolute best to, answer all of your questions on a timely basis, which is why we're hosting these calls to help kind of manage the influx of requests coming to our team and to Dr. Pombo. So with that, I will wrap things up. Again, we have recorded the session. We will be posting the session to our dedicated coronavirus website, so www.capecodhealth.org/coronavirus. And there's a section for CCHC resources, and so we'll be posting this recording there. We can send out a link to that recording once it's available. We'll also be sending out a link to the HIPAA information regarding COVID-19 for the media. So please take a look at that, and I think that's it.
Thank you, everybody.
All right, thank you.